My name is Tess Meaden. I've just completed my third year of a Bachelor of Laws, Bachelor of Arts, majoring in International Relations and Politics at Swinburne University.
What I asked Tess to do was to investigate access to perinatal mental health services in the Inner North.
Obviously, a lot of the research that has been done in perinatal mental health has been focused on mothers. There's actually a lot that hasn't been done on fathers. However, the research that has been done tends to suggest that fathers are impacted the same as mothers.
This is something that is really close to my heart because I've got two very young girls, but I know that it's also something that's really important in terms of our community because it has such lasting and long-term flow-on effects for parents and children and the wider community.
My report focused less on providing recommendations and more on just identifying service gaps.
The bit that surprised me was that there is such a gap between access for people who have the private health insurance and people that don't.
Basically, there is just a lack of public services. There's lots of private services, and if you have the money to access them, you'll be able to find help. But for women, and for fathers too, who don't have the money to access these services, it's very difficult to find them, particularly in Melbourne where there is sparse resources.
I think the value of the Victorian Parliamentary Internship Program is that it not only gives students a really in-depth insight into what public policy could be, but it gives us as members that evidence base to actually be forming and informing public policy itself.
The thing I took away from this was, because I did it during COVID, it was a lot of self-driven work and a lot of determination that I had to find within myself, and I think what I got the most out of this program was that I have the ability to do it.